Good afternoon. How are you, Chris, with EHS Physical Therapy Chiropractic Services, along with Brooke? So, this is something that I saw recently, and unfortunately it still happens all too often. And it's good to have Brooke's perspective as well as a new graduate. I'm kind of old, but we've got new graduates and we've got old men that have done this for a little while, but there's still some clinics, some places out there that kind of do the old cookbook method. So anyway, I'm going to back up and tell you what I saw. A lady that had posted she has a lower back issue, a problem. She has a herniated disc in her back. Okay, that can mean a lot of things. Sometimes that has no pain. Sometimes it does create pain. When it creates pain, it can either be just in the back, or in her case, she had symptoms in the leg, spasms in the calf, like muscle cramps, and some symptoms in the foot that involve like some numbness, tingling, okay? So not abnormal. We see that kind of thing quite often. That is something that it changes, it typically comes and goes, or even if it's constant, it at least changes in intensity, all right? So she had posted, well, I went to my first, therapy session, and my foot is more tingly. Okay, numbness tingle is not always the most reliant or the most predictive of better and worse, but it's okay. The next thing, well, and my calf is more, or is spasming again, is getting more cramps, and I didn't really feel any different or any better. Here's what they did, and she listed it. She said, well, we did a bike thingy, and then what was the next thing? A calf stretch. Okay, a calf stretch for a back injury, a calf stretch. Like a piriformis stretch, some kind of hip or buttock stretch, whatever. Traction, and then in parentheses, which I didn't like. Okay, so she didn't like this. Something didn't work out with that. And then
a tens.
Yeah, tens unit, some kind of superficial, muscle stem. Now, if you go to some place and you experience that, you need to leave. You need to run away. That is not good quality care. That's not appropriate. At no point did they even, to the best of my knowledge, affect the tissue or the problem that she's actually having. Right. So this is a low back issue.
Yeah. Or even attempt to look at it.
No.
There was nothing at all.
What were they doing? Stretching the calf. There's no calf injury. She feels cramping in the calf because of irritation of the nerve in the back. That's why it's down there. A calf stretch is not going to do anything.
No.
And so that all too often we've seen this as this old model of, well, what is physical therapy? Well, physical therapy is hot pack, E-stim, and hamstring stretches. That's not what it is anymore, and it shouldn't be.
No.
If that's what you're getting, that's wrong. You got to go to someplace else. Now, I don't know if what they talked about, in school. But that's what I kind of wanted to have, Brooke's perspective as well. But even when I told her about it, she's like, "That doesn't sound right."
That doesn't sound right at all. Also, it doesn't sound like there's any skilled, anything to that. Like anybody could be like, "Oh, your calf hurts. Maybe let's stretch it. Let's try that out." Not trying to find the root cause of the problem at all.
And see, and that's I just thought of this. The other thing that she posted was went to her first session, right? Mm-hmm. And so why would you throw someone on a bike thingy on the very first session when you don't even know, you haven't even assessed and figured out what the problem is or what's going to change the problem? So just by throwing them on the bike, that's just you're just wasting time trying to just kill time in order to get a charge for it. The only thing possibly that even had anything to do with the low back, the lumbar spine, was the traction. She didn't like that anyway, and traction is really garbage. It's what you do. Yeah. It works for some. It doesn't work for the majority, and it really just tells me that the person that was treating her was like, I don't know what the hell to do, so I'm just going to pull on her and see what happens. I mean, it's because. And then the tens unit, that's just superficial. There's no fix there.
Again, not a long-term thing by any means. The bike probably made it worse, being in.
Yeah, flexed. Yeah, I mean that's because they didn't assess it. So we just wanted to. When I see those things, and again, this is from one side of the. We weren't there. I don't know what really happened.
Maybe it wasn't as bad as her post made it seem like, but.
But if there was any truth to that, really all of that whole treatment was garbage.
Yeah, no,
I mean,
there wasn't a single thing that would actually like help long term that they did.
especially for the first visit, trying to assess what the problem is,
Yeah.
subclassifying, subcategorizing, and trying to understand what is going on, what is her problem, where is it coming from. Once you understand it, then you can fix it. But before you understand it, you really can't fix it. That's essentially saying,
Right.
I'm just going to throw a couple things at you. I'm going to hope and pray that time and the body's natural ability to heal over the course of 10 or 12 visits, you'll feel better. Because I don't really know what to do. I'm just
Not
going to,
doing anything.
go ride a bike and try this and then do this little stretchy thing on the calf and
Yeah.
calf stretch.
Yeah, stretching. But I felt good during
else,
it.
bro?
Like
Yeah.
that might have been okay. Yeah. I mean, also like really, if you're riding, like just doing like a bike every single time, like, that's probably a warning sign.
That's a sign.
Yeah.
Yeah. If they just put you on a machine for 20 to 30 minutes, 20 minutes on a bike or a treadmill, just
Right.
just because.
Yeah.
There's
Especially
reasons
if they're
to do
not,
it.
like checking on you too. Like,
Yeah.
If they're not checking like how you're doing throughout it too, like if they need to change anything,
Yep.
they're just like, oh hey, go ride a
Same
bike.
settings,
Or,
same.
yeah, especially same
No
settings every
progression.
time. Yeah.
If they're doing it, there's reasons where you could do it where you want to actually like build some endurance or something, but
Right.
it's still, that didn't sound like it on the very first visit.
Yeah.
Because she said, I went to my first PT session, and here's what they did. Because she's asking, the question is a legitimate question. She's asking, has anybody else experienced this? Like, what should I do? Like, is this normal? Is this normal PT? And so it's not. I mean, well, it is. All too often, it is normal, but it's not good. It happens too often, but it's not good. So yeah, so we're telling you almost like I don't know if it's like a PSA, like a public service announcement. Like, if that happens to you, you're in the wrong place. That is
Yeah.
not a good place to be getting your care from.
Yeah. Or if you ever wonder if like you're getting good care or not, ask them why they're doing it.
Ask the
them
question.
for a justification for like, why are you having me on the bike? Like, what is your goal with this? And they can't give you a good reason. It's not a good treatment. Like, they should be able to justify every single thing that they do for you.
That's a good point.
Yeah.
You should, don't take the word of your provider, your chiropractor, your physician, your physical therapist, anybody. Like, ask the question: why am I doing this? What's the purpose? What's the outcome that we're looking for here? How does this help me get to my goal? Like, where are we going with this? That's a very good question. Yeah, I think all too often we're trained to just do whatever the doctor says, and that's not anymore. Like, maybe 20, 30, 40 years ago, but not now. In the information age, we can find information and gather information and learn things so fast that they better know what they're doing and not just do the old same thing over and over again, which would be the cookbook, hot pack, E-stim, hamstring stretches. I mean, honestly, I worked in a clinic like that. When I first got out of school, before I was a physical therapist, as an athletic trainer in Las Vegas, I worked in the clinics in the summertime because we were in the schools in the regular year, and in the summertime I was in the clinics in the summertime. Working for Health South, that company's still around. I hope they're not as garbage as they were back then. They actually went through a huge they almost folded because they were cooking the books. It was a big deal. So, but that's exactly what the therapists there were doing. They'd have just tons of people coming in. Everybody got hot pack, E-stim, and then the athletic trainers or other staff would run them through a couple of stretches and stuff when they were out the door, and the therapist was basically just kind of doing notes and kind of just checking. Terrible, terrible, terrible. One of the main reasons I thought to myself, well, I could go back to school and do a better job than this. This is terrible. I mean, this is terrible. That's actually why part of the reason I went back to school and do this now was my experience as a 22, 23-year-old athletic trainer, working in the high schools by myself and then coming into the clinics in the summertime and looking like, what, like this, that's all they do? That's all they do? It's just a couple, how does that help? I don't know if you had any places like that in any clinicals or anything?
No, not really, not that bad for sure.
That's good. Maybe we're changing. Maybe I hope we're.
I think a lot of it depends on the setting too.
I hope we're improving and evolving as a profession and getting better and learning from this is not the way that it used to be done anymore. Okay, that's the main thing I had. Anything else? We just wanted to share that.
So,
All right, guys. Enjoy the rest of your week. We will hopefully, if you have any questions, though, you can ask us any questions. We'd be happy to answer anything. Even if you're wondering, like, am I in the right, like, are they doing the right thing? Like, let us know, and we'll talk to you. See if they're doing the right thing. Thanks.